Socket shield is a solution to a problem I never have. So socket shield is a technique with which we leave a portion of the sick tooth behind such that it holds the labial or buccal plate in place so you get a better aesthetic outcome. In my practice, I will never do this procedure. I will never need this procedure, and I find it to be something that is a solution to a problem that most people should not have. Let me explain. The concept behind the socket shield is that you leave a small sliver of tooth on the labial or buccal side of the socket. You leave that intact. Let's say that the sliver that you leave behind is 1 millimeter. Okay? Now, the buccal plate, the labial plate, for most people is 1 millimeter or less in 90% of the population. So for the purposes of easy math on a YouTube video, let's call it a millimeter. So you got a millimeter of labial plate, you've got a millimeter of tooth structure, and then you place the implant lingual to that, palatal to that. And therefore, you are ensuring that the implant is in the right location. Okay, guys? The right location for any dental implant is at least 2 millimeters lingual or palatal to the labial plate in every case. It's called the 2B rule, 2 millimeters of buccal bone, okay? So in this particular case, what we've done is we've got 1 millimeter of natural bone, then we've got 1 millimeter of tooth, and then we've got the implant. And then what we do is we gap graft around the implant and we let it heal. And the reports show that if you do that, you get a really good aesthetic outcome, okay? Well, that makes a lot of sense because you got 2 millimeters of hard tissue, then you have the buccal thickness of the attached gingiva and the mucosa on the facial, which is about 1 millimeter, 0.1, 0.2, 0.3, roughly, at most people. So you've got enough soft tissue and you've got enough hard tissue to hide the grayness of your implant. Beautiful. And then it maintains because you've got blood supply and it maintains. Well, this makes a lot of sense. Now, here's the rub. If you've listened long enough, now here's the rub. The rub is this. What do we do when a socket shielding process goes south? So the patient is healed and the socket shield becomes loose and it becomes infected. Well, go to the literature and it's clearly abundant. The answer is as clear as it could be. You retrieve the sliver of bone, of tooth rather. You retrieve the sliver of tooth that's loose. You clean out the infection and you gap graft. Now, imagine that when you did this, the buccal plate was intact and it's 1 millimeter thick. And you gap graft with 1 millimeter of bone. You now have 2 millimeters of bone in the buccal, 1 millimeter soft tissue. It hides the gray implant and the problem's solved. In fact, you can see these in the journal articles all the time. Here's a socket shield case where the shield failed. It got sick. We had to take it out. And when we did, this is how we recovered from it. And look at our beautiful outcome. And I just can't help but ask the following question. And hopefully you'll see this. Why did we take on that risk in the first place? If the solution to a failed socket shield process is to do a gap graft, is to remove the remaining tooth structure and do a gap graft, what if we just took out the tooth in the first place, placed the implant in the right location, which is labially enough to have 2 millimeters of facial bone, one of which we gap graft at the time of surgery, and the other one is still the intact labial plate, and we have 2 millimeters of bone. We don't have any gray show through, and we have great aesthetic long-term outcomes. So why take on that risk, folks? To me, it doesn't make any sense whatsoever. I like to have a practice where I have low risk and a high probability of success. So in my cases, what I do is I place the implant in the right location, which socket shielding is driving doctors to do. Okay? It's driving them. It's actually an inadvertent way of driving people to place the implant in the right location. But if you place the implant in the right location and you simply gap graft, you'll get a beautiful, lovely, long-lasting aesthetic outcome. Pink aesthetic scores will look great, white aesthetic scores will look great, and it'll be stable. So hopefully that helps. That's why I'll never do a socket shield. I'm Dr. Robert Stanley, the Smile Engineer, helping you re-engineer your practice every day.